So let us talk about the overview of the cardiovascular system disorders. Now there are various etiologies that can affect the cardiovascular system. This will include vascular, which includes atherosclerotic and non-atherosclerotic risk factors, infective processes, autoimmune disorders, neoplastic disorders, genetic or congenital processes, and degenerative causes. All of this can affect the cardiovascular system and can involve different anatomical parts of the system. Traumatic is also a very rare cause. Now, depending on which anatomical part of the cardiovascular system is affected, the disorders of cardiovascular system can be classified under the following headings. If the pericardium of the heart If the pericardium of the heart gets affected, then it manifests as pericarditis, cardiac tamponade, which is an acute emergency presentation, or a pericardial effusion, which is a chronic presentation. Next, it can also affect the myocardium, causing myocarditis or cardiomyopathies. They can affect the endocardium, causing endocarditis or valvulopathies, which are commonly called as valvular heart diseases. And lastly, they can also affect the vasculature, which can be the central vasculature, which is the great vessels, or the peripheral vasculature. Affecting central vasculature can lead to aortitis and aortic dissection, whereas affecting the peripheral vasculature can result in peripheral arterial disease or venous disorders, which includes the varicose veins. So now there are three principal pathophysiological mechanisms behind the cardiovascular system disorders. Atherosclerotic or non-atherosclerotic mechanisms affecting the central coronary arteries can cause ischemic damage to the heart's myocardium or ischemia. It can also cause an interference with the electrical circuit of the heart, resulting in unsynchronized electrical bombardments and cause abnormal electrical rhythm within the heart, resulting in arrhythmias. Ultimately, all of these mechanisms will interfere or impede the pumping mechanism of the heart, resulting in an impairment of the systolic or diastolic functions of the heart, which is also termed as heart failure.